Are crutches or knee scooters slowing you down? Then toss the crutches and scooter and go hands-free with the iWALK crutch. It's a new era. Walk, climb, carry, get your life back with the iWALK hands-free crutch. All the activities you can't do on crutches or scooters, you can now do on the iWALK crutch. If you have a lower leg injury, now you can stay fully functional during your recovery. iWALK3. Live your life. iWALK is an FDA-registered, clinically proven Class 1 medical device.
Hi, my name is Tom Stukins. I am a musculoskeletal physiotherapist with 22 years of experience treating all manner of sports injuries, occupational injuries, and rehabilitating people following orthopaedic procedures. On the 2nd of October 2021, I ruptured my own Achilles. And at that point, I was faced with a whole new reality. As like many of my clients, I am very active, always on the go, cycle commuting to and from work, playing tennis regularly and visiting the gym. And so to be confronted with a period of time being unable to exercise in any of the normal ways, I was desperate to try and find any way to remain as active as possible. Over the course of my career, I've been exposed to and come across various aids to help people become more functional and improve their mobility. And one that had come onto my radar was the kneeless crutch, or the iWALK3. Directly after my injury, once it was confirmed on the ultrasound, I was confined to a plaster cast and non-weight bearing for an initial period of 2 weeks. And then I was transferred into the mobility boot, or the vacuoped boot, for a further 6 to 12 weeks. Unfortunately, 5 weeks into my initial rehabilitation, I managed to re-rupture my Achilles, putting me back to square one. I then had another 2-week period in the plaster cast and then a further 12 weeks in the boot. Being non-weight bearing means that you have to use 2 crutches all of the time, which makes the simplest of tasks seem very difficult. Cooking your dinner, carrying a drink, doing any kind of activity requiring any arm movement and use of your arms becomes virtually impossible. I had to find a way to try and make my life easier and to give me some function and some independence back. Having been exposed to the iWALK3 in the past, I was keen to try and get hold of one as soon as I could, and through Crutches.co.uk was able to get my own unit. When the unit arrives, it comes packaged in a box, and should anyone require them, there are good videos online which help make putting the iWALK3 together very easy. Once the iWALK3 has been constructed, it's really important that you take the time to make sure that the height is adjusted to the right level for your height, and that you take time to adjust the straps to making sure that they do feel comfortable and fit well around your leg. By doing so, it means that you're going to have optimal biomechanics, meaning that the rest of your joints in your leg are all going to be kept controlled and safe, and to make sure that you're not limping when wearing the iWALK3. Using the iWALK3 for the first time was daunting, but given practice, you soon get used to it, and trying to get over that initial fear is well worth it for the freedoms that it affords you with your day-to-day function. Once I got used to the iWALK3, I was able to gradually spend more and more time cooking, cleaning. I even managed to go around Tesco's and get on my daily shopping with the use of the iWALK. Using the iWALK in the plaster cast was very straightforward and very simple, and had even pressure distribution across the whole calf and shin. But in the vacuoped, which is now the gold standard treatment for the management of Achilles ruptures, the slight problem occurred with the valve being placed on the front of the shin, meaning that the pressure going through the pad on the iWALK3 was unworkable. As you can see, with a little bit of imagination and with a little bit of upholstery cushioning, you can create a workaround, which means that the valve now sits in the void between the two padding, meaning that once again you get used to the pressure distribution, you can build up your tolerance and have quite a lot of stamina in order to give you your freedom back once again. As a physiotherapist, I would highly recommend the use of the iWALK3 for anyone who has ankle, foot or Achilles-based conditions that require them to be non-weight bearing for a period of time. It really is a good way to get around, even using it on stairs becomes possible. And I will certainly be recommending it more and more to my patients who I see who are faced with similar circumstances and for those who have broken toes, broken ankles and so on, that require the ability to walk with their hands free.
Hello, my name is Aodhan and I have functional neurological disorder. Functional neurological disorder for me impacts on my right arm, on my right leg, and affects my ability to move, restricts my mobility, and causes me severe pain. Now, I was provided with two crutches by my local NHS trust, and for the last 4 years, up until I received my iWALK 3.0 from Crutch.co.uk, my quality of life was extremely poor. To say that life since August of 2022 has been a game changer is an understatement. Things that you might take for granted, such as going to a shop and having an arm free to carry a bag of groceries, or for example, if you do have children, missing out on being able to watch them train, or play a football match because you can't actually physically walk to the pitch. These are all things that for 4 years I did miss out on. Thankfully, since I have received my iWALK 3.0, these things I don't miss out on anymore. I am so reliant on my iWALK 3.0 now that I'm about to purchase a second one as a spare just in case anything should happen, because I don't want to go back to using crutches.
Go on.
Never. Okay, go. That's with no way.
My name is Angie, and I've been a below-the-knee amputee for 7 years. I spent years on crutches and on a knee scooter. I wish I would have known about the iWALK when I first became an amputee. It would have made daily tasks so much easier and would have saved me from many falls. The first time I put it on, I was able to walk hands-free immediately. I had a revision last April, which led to several more surgeries, so I spent 8 months in the iWALK. But I was able to go back to work a couple weeks after each surgery because of it. I also live in a 2-story house. It made it so much easier and safer going up and down the stairs. I got my prosthetic back about a month ago, and I'm not able to wear it all day yet because my leg gets sore. I still use the iWALK every day to get in the shower instead of using a shower chair. This is a huge deal for me because the shower is a scary place. I feel safer, and I'm not worried about falling. I use it when I get up in the middle of the night to use the restroom. I take it when we're getting in the pool so I don't risk getting my prosthetic wet, and it's easier to get on and off. This past summer, we had booked a vacation to Mexico before my surgery was planned. I went in the iWALK because nothing was stopping me from going on our family vacation. I walked all over the resort and the beach. I have been able to attend all my kids' functions with ease. It allows me to keep up with my kids. I recommend the iWALK to every below-the-knee amputee I meet because it doesn't limit my activity and it keeps me hands-free.
Hi, my name is Wayne Morton. I'm a physiotherapist, 45 years experience. I've been the Yorkshire Director of Medicine Cricket for 40 odd years, and at that time I've been in Rugby League for Leeds and Castleford, and also England cricket team for 10 years also. So I've been around sports for a long time, and we get thrown an awful lot of inventions and new products. But I decided I'd do a testimonial for this iWALK because it's been fantastic for me. 4 weeks ago I snapped my Achilles. Anybody who's done that knows what a nightmare injury that is and the immobility that brings on. And after 3 days non-weight bearing on elbow crutches, which we know are partial weight bearer in crutches, and having no hands and complete immobility and unable to get about, by the time I got anywhere with a cup of tea it was empty, it was proving impossible. I found Steve and the iWALK, and I thought I'd give it a try. So having just took about an hour to get used to it, it was an absolute revelation. I no longer needed the crutches, I could balance on it, I could do everything on it, it freed up my hands. I became a normal person with a ruptured Achilles. So I could function normally, I could wash up, I could clean the house. As you've seen, I can even do extreme things like cut the grass, cut hedges, wash cars. It's been fantastic. I wasn't told about it, sadly, in the hospitals. I found it myself, but you can find it yourself by either watching this video or scanning the QR code, and you can find how easy and how good a product this is. You know, the iWALK makes such a difference in just simple household chores, just like washing your hands, getting a drink, drying, just moving about the house. Such a difference than when I was on 2 crutches, when I had no hands free to do anything. I couldn't carry a drink, couldn't wash up, couldn't do anything. iWALK, been brilliant.